So we need to be able to identify the child with sickle cell disease. Then we need to be able to place these children in areas where they can access care. Prevention of complications is very important. The children have to be looked after. They have to attend regular clinics. They have to be immunized against infections. They need to be protected from malaria, because malaria is still a significant problem in our environment, and it triggers up a lot of crises in children with sickle cell disease, including painful crises, needing blood transfusion, convulsions. So they need to be protected against malaria. We do this by giving them some medications and by environmental control using the insecticide-treated mosquito bed nets and looking after the environment. In addition to that, the children themselves have to know about the disease. Not only the caregivers have to know about their disease, but the children themselves should be educated as early as possible about sickle cell disease, which is a lifelong disease for them. So they have to know how to drink a lot of water, which helps in preventing their painful crises. They have to know that they can play football for one half of the match and sit out the other half of the match, so that they can have a regular quality of life. In preventing some of the more severe complications of sickle cell disease, like stroke, there is a way in which it is possible to identify the child who is at risk of having a stroke. And this is by doing a test that is called a transcranial Doppler ultrasound. This test is done by looking at the blood vessels that are going to the brain, and if there are any abnormalities, it's a simple, very non-invasive ultrasound that just measures the blood vessels going into the brain.